We really appreciate you guys speaking because I know you guys are still kind of in the trenches of this journey. So can you tell us a little bit about like how it started and where you are at now?
Sure. You want to go? You want me to go?
I can go. I mean, I think it started like everyone's journey starts, where you don't expect to have a problem and you just think, oh, I'll be pregnant by Christmas for sure. And then, that first year goes by and you're like, oh, I'll be pregnant by next Christmas for sure. And it doesn't happen. And our journey is complicated too by him being gone a lot in the military. And so I kind of also really held on to that hope that, like, well, maybe it's just like a timing thing still, and it's not going to happen every month, but maybe like things are still okay. And it's just because he's gone this month that it didn't work. Um, but from there, obviously, we decided to start getting testing, and I found out I had endometriosis. And so we had surgery, we tried IUIs, and then kind of started IVF.
Did you suspect that you had endometriosis like growing up?
No, I had no idea. I mean, I had like symptoms, but like I just thought it was normal until we started talking to my doctor. Really, actually, when I had an IUI, it was a week after the first IUI. I had severe pain. Like I was on the bathroom floor for an hour. I called him. Um, And that's when the doctor was like, and I think that happened the second time too,
Yeah, it's two
after the
rounds.
second IUI, like a week after the trigger shot. And that's when the doctor was like, I think you have endometriosis. And she recommended a laparoscopy.
And you went through that, right?
Yeah, that was in 2023, July.
Yeah, middle of 23.
Okay. And so how many IUIs did you guys do? Or how many have you done?
We did 3 rounds of IUI. So we did the 2 rounds, and then
Before surgery.
prior to surgery, and then we had the surgery. During the surgery, we were optimistic coming out that the surgeon, the way she described it, basically the endometriosis had adhered so much to the fallopian tube. She said it was basically like throwing a necklace in a drawer and slamming it closed a bunch of times. The fallopian tube is super knotted, essentially, for lack of a better word, from the surgeon's perspective. So she said, basically, thank God you guys did this. You never would have naturally conceived. It basically was impossible. And then coming out of that, we were pretty optimistic. So we did another round of IUI. But during that surgery, removing the endometriosis, they damaged one of Kat's ovaries. So we were kind of down to one ovary at that point. So we made the decision after that to pursue IVF on the doctor's recommendations after the third IUI round.
Okay. Did you guys do anything special? No, we had a board member who had endometriosis and she swore up and down that if you did it this way, it was going to work. It was something with like Lupron or something. Did they do anything special for you
Yeah.
to try and suppress that?
Yeah. So after the surgery, I was on Lupron I thought it was just going to be 30
It was
days.
60 though.
Or 60, but I remember I couldn't believe how long it took for the side effects to wear off. I felt like they didn't, our doctor's great. I just felt like I wasn't prefaced on that. Like it was going to last like 3 months of hot flashes and side effects. But yes, we did do the Lupron, and then it's a shot. It was every 30 days times 2, I think. And then once all that wore off, that's when we tried a third IUI. Did we do 4?
No, we only did 3 because Dr. Boca recommended after the third that we not do another one.
Okay.
You're like, it's kind of a blur at this
At this
point.
point, I can't.
What have I not
Maybe
tried
we
is the
did 2
question.
more times. I can't remember.
Yeah, it's been a near 4 year.
Maybe we did.
Yeah, near 4 year journey at this point. So it kind of blends together sometimes.
Yeah.
Totally. By the end, I was like, what have I not tried? Because let's do that.
Yeah.
Okay. So you do these IUIs, your recommended IVF, then what?
Yeah. So I think at that point, I'm 34, right? So I really went into this like, oh, IVF is definitely going to work for us. Like, it's just because of my endometriosis. This isn't going to be a problem. Like, I'm under 35. Like, this is great. It will be fine. You know, nobody wants to be here. It's a lot of money, but okay. So I remember from the IUIs that since my surgery, my right ovary hadn't woken up yet. And it was just my left that made the follicles. But for the first round egg retrieval, I went in for that baseline appointment and they couldn't even find my right ovary. It didn't have any follicles or anything.
The one that hadn't woken up yet?
Yeah,
Or the other one that was supposed to be
Yeah.
good?
No, the one that was damaged during surgery.
Yeah, it had like a cyst, and apparently that was really bad. So that first egg retrieval, we only had one ovary that responded. We got 7 eggs, I believe, from that one. 4 were mature, 2 were fertilized, 1 embryo, but it was genetically abnormal.
Oh, shit.
Which the genetic testing I'm so thankful for. And, you know, I learned by listening to a podcast because they didn't require it since I was under 35, but I would tell everyone to get the genetic testing. It will save time, money, heartache. And so then this is where the story gets crazier.
Yeah, the second round.
The second egg retrieval. That was August of
24.
Yeah, because it was right before my birth. It was right after my birthday. So same thing. My right ovary just isn't producing anything. We only have the left, and we go in. He gets like 8 eggs, and same thing. 4 mature, 2 fertilized, 1 embryo. It was abnormal. But so when I got home from that egg retrieval, I was in like way more pain than the first time. But I was just like, oh, maybe they just had to push on me a lot. Like, I don't know. You took the medicine, it wasn't helping. And by 6 o'clock, I was in tears. We had called the doctor twice. I'm a nurse too, so I knew like something was wrong. She's like, oh, just drink more fluids. It's okay. Or the nurse. And so we called him again. And then they were like, okay, I think you need to go to the hospital.
Well, not exactly. They actually so I talked to them on the phone. They kind of were like, oh, yeah, it's up to you guys. And then I was like, no, we're going to the ER right now. This is abnormal. I've never seen her in that much pain.
Yeah.
So we went to the ER, and yeah, it turned out they basically had, I guess, not punctured her ovary, but essentially when they were taking the follicle off of it, they either pushed the needle in too far. There's this 0.003% complication that
On the consent form, it says
that
0.3%.
that she happened to have, and she basically started internally bleeding into the ovary. So we spent about a day in the hospital sorting that out.
Yeah, so my ovary bled, and it bled so big, it was 12 centimeters inside.
Oh,
Thankfully, it stopped on its own. Once the pain kind of subsided by the morning, the doctor was like, okay, like, the bleeding must have stopped. So, because for a second they were talking about surgery. And so then it was 2.5 months after that my ovary was so big, and they were really worried about ovarian torsion if it were to flip over. So I couldn't run or work out or do anything. I couldn't even work as a nurse for a month. And that was really, really hard. That was my lowest point of the journey, because it also had all this happen where I couldn't even work out, and we didn't even have a successful embryo from it.
yeah.
And also, I think complicating and making it tougher was the right ovary had not worked at all, and this was the one good ovary that we had, and we weren't sure that it was going to respond and get better at all. It was like you're going bi-weekly maybe to get ultrasounds, and it's like not really seemed to be reducing in size. And yeah, there's some dark days there for a little while.
Yeah. So it started at 12. Oh, sorry.
You just have these things that like at least you can focus on, like going for a run or a walk or going to work with like your colleagues. Like I'm gonna get buoyed up by like these things that I know like are my go-tos, and you couldn't even do that.
Do nothing.
Yeah, right.
That would be so hard.
And I obviously with my job, I can't just stop doing it. So spent a lot of time where I just had to leave, and unfortunately, Kat
Oh,
has to sit there and endure it by herself, and just a lot of
yeah.
FaceTime and phone calls when able. So
So
You're
that
a tough
delayed.
cookie, Cat.
yeah,
You are. You're amazing.
Well, the silver lining of that bleeding, the doctors can't tell me why. I have my own theory of like when the left ovary was damaged from the bleeding and the blood clot. I feel like all my hormones had to go to the right ovary. So the right ovary woke up.
Oh,
Yeah. That was
good.
like,
yeah,
that was the silver lining of that.
yeah. I remember we were together. We went into the ultrasound, maybe it's 2.5 months post, and it was like magically all of a sudden now there's a follicle on the other ovary, and you're like, where the heck has this been for the last
Oh
six and a
my
half
gosh,
months?
seriously.
So
Wow, that's incredible.
yeah, so small victory there.
Yeah, and that's what it is in infertility. They're very, very small victories, but it's enough always to just get you to the whatever the next step is, which is what? What do you think is your next step?
So I was getting monthly ultrasounds with our doctor, and it was decreasing by size, like 1 centimeter a month. And it got down to 1.9 or 19 millimeters. And this was in February. And I told her, like, we knew we wanted to do another retrieval. But I was like, at that point, like, I was finally working out again. I was feeling good. And I just told her, like, I'm not in a hurry. I just want to be as healthy as possible. Like, I felt like this was our last chance, and I wasn't in a rush. And one thing that changed for me too in that 6 months time after the bleeding was before that, and I think most people can relate, I used to hold on to like every single month. Like every month I wasn't pregnant was just another like 9 months until we'd have a baby. And that 6 months of recovery and that break really helped me to like let go of that
Mhm.
and kind of focus on the bigger picture, which was like my health. And like one way or another, it might not be in, who knows? I'm 34. Hopefully, sometime between now and I'm 40, like we'll have a baby. But it really, I just stopped clinging to every single month. And that was
Yeah. And that was
a
also the
relief
first time really since we started that she had cycled off medication, hormones.
since surgery.
Really since, yeah, even predating the first surgery, I think leading up to the IUI
Yeah.
cycles and everything else, like there's been this continuous stream of, all the deleterious effects of just drugs and hormone therapy and just month after month for multiple years. So I think, yeah, that 6 month was kind of was a good grace period to get back to normal a little bit.
Yeah. Oh my gosh. Yeah, I tell my husband all the time, I'm like, who knows what you're gonna have to deal with for me later in life after all of these egg retrievals and stuff. Like, who knows what kind of damage that did. It got us our 3 children and we are forever grateful, but like when I'm like 60, what's that gonna do to me? I don't know.
I
Yeah,
know,
I
I
think about it all
worry.
the time. It,
Yeah.
it can't be good. I know that much.
It can't be good. No. I feel like there's just, I mean, like I think it was the first IVF baby that was ever born just barely died. So this is still so new. We're still like one of like the first wave of people who have really, done multiple rounds and all the new things that they're trying and biopsies of this and so there's just so much that we still don't know, obviously, and like the repercussions from it in the future.
Yeah.
But okay,
So,
so are you thinking you're gearing up for another IVF, like another egg retrieval, hoping that the right one succeeds this time?
so,
No,
That
hopefully
the
we're done.
right one pulls through for us?
Hopefully we're done with the retrievals.
so yeah, the last part of the story in February, the doctor was kind of like, for our third retrieval, I told her I just wanted to wait till I was healthy. I wasn't in a rush. She was like, well, I think it's now or never. Like, I think you're ready. Like, we can do that. So we did a third retrieval in March. And I literally went into it crying. We only had 3 big follicles on my right ovary this time. My left had a bunch of small follicles. So, with our statistics, we were just saying like this was definitely the hardest round, like side effect wise.
Yeah.
And we just felt very hopeless. But somehow, with only 3 big follicles and other smaller ones, he retrieved 5 eggs that were all mature,
Oh my gosh.
but still only 2 fertilized. But both of them made it to day 6 and they're both genetically normal.
Oh my gosh, that's incredible.
Yeah.
That is wild. I'm gonna cry. I can't believe it. I thought for sure this was you were gonna be like, and then I'm gonna be like, oh my gosh, throw these people a bone. Come on. Oh
Yeah,
my
we got our bone. I
We-
was actually on a vacation with my family, my cousins, so I told them to call him. And they called him on a Saturday morning and he calls me, his eyes are watering. And I'm just like, what happened? Like,
Yeah. Who died?
yeah,
Yeah.
literally.
Yeah, it was. We were talking about it last night, actually. Just kind of preparing for this, and like that was definitely the darkest moment leading into that because we had one good ovary, which is not working at all. We're thinking like, do we just waste all this money on this cycle? It's going to be a failed cycle. The drugs had seemed to be like particularly bad that cycle for whatever reason. The side effects she was experiencing were like worse than the first 2 cycles. So I was like, my expectations were so little for that one. And then it's like, oh, well, we only have 3, and then it's like 3 follicles compared to like we had 10 or 11 on the one good ovary the first couple times. So my expectations were so low. And then, of course, when the embryologist calls, she goes, all right, well, have you prepared yourself for the news? Just the tone in which she said it, I was thinking like, this is more bad news.
Yeah.
And I was driving, and then she says, you have 2 genetically normal embryos, and then immediately asked me if I want to know the sex. And I was like, yes, I do, but I don't know if Kat wants to know. So I need to call her, but she's in Mexico. So let me see if I can get a hold of her. But yeah, I've actually never cried tears of joy in my entire life. It had never happened to me, and it was the first time. It was that moment in time. So
Wait, I didn't
Oh
know
my
that.
yeah.
That's
I
so
think you
sweet.
cried tears of joy before.
No, I never have. Never once. That was the first time.
Well,
Like
you've
true
put
tears of
in
joy.
so much to get there, like so much. And I think everyone that's listening to this is, if you've been through infertility, like they are going to understand like those highs and the anticipation of getting those calls. And just like I had a cycle that was just so bad. I was so miserable after, and my numbers were so bad. And I was just like, how is this all so bad? Why do I feel so bad? Why are the numbers so bad? And yeah, it was just one of those things where I got to the end and it had like a happy ending eventually. But yeah, the heartache that you have to get there is just excruciating.
Yeah, it's terrible.
Okay, so they're frozen.
Yeah,
Yes.
they should sit
And
on ice.
do you know the sex?
No, I don't
No.
want to know.
Oh, you
'Cause
don't
I don't
want
want to choose.
to. Okay, but Chris, do you know?
I don't know.
Okay.
Yeah, I do want to know, but I told Kat doesn't want to know, so I won't know until if it hopefully works. So
They
Yeah.
said they could tell him. I told him, if he really wants to know, but I
no,
don't want to like have to choose and then like, if it doesn't work or something like
Yeah. It personifies it a little more for sure.
Yeah.
Yeah, we never did genetic testing, so we never knew either. Um, which I always told my husband that I wanted like my water to break in Walmart and be like running around like I'm going into labor. But because I'm like, there's nothing fun about what we've done to get here. Nothing is spontaneous. Everything was planned. Like I need something that's just like so out of the ordinary, and it never happened to me. And I was so sad. I got induced with all 3 and I was like, dang it. So, but I get that. Just having like some sort of mystery to it just makes it feel a little bit more like we didn't just like sell our souls for this and everything in a petri dish, you know?
Yeah,
Oh my
exactly.
gosh.
Yeah, it's science, baby.
So, yeah. Okay, so they're frozen and you're probably planning on doing a frozen embryo transfer?
Yeah, we're gonna do that in the middle of June. Because of my endometriosis, she kind of recommended taking birth control for at least a month because coming out of that egg retrieval, they usually want you to just get back on birth control right away. But I was very much like, I didn't want to do that. I
Need a
wanted to
break.
get back to normal and feel good and healthy. And so I'm okay that this transfer has been pushed a month, but
Yeah.
I feel good. And that's now like, you know, really important to me. So.
Yeah, yeah. Having a good headspace is so important. When we interviewed the therapist last year, she just talked about how, because this therapist had been through her own infertility struggles and an infant loss. And so she was like, you got to just take care of you for a second. Like, it will all be okay, even if you just have to take a month or two to just like regroup and regather. And yeah, you got to do that. So
Yeah, absolutely.
that's so exciting. Okay, so you guys kind of told us your probably like your peak and your pit of this journey. It sounds like there was a lot of things that looking back on it now, you're kind of like, I wish the doctor would have told me that, or I wish I would have like, so what do you feel like some advice for, because your diagnosis now is endometriosis, right? That's
Mhm.
why they're saying you're doing all of this. What would you say to people that might be in your same boat, or even people that have had a similar IVF cycle turn out the way you guys have? What's like some things that you would say, like, I would definitely ask your doctor this, or I would pay attention to this, or anything like that?
Um, I mean, I already said this. I would definitely do genetic testing, for sure. Um, and then I had also set out, with the Lupron, like the side effects last longer than just the 30-day shot that they tell you. Um,
I think we're,
what else? I have some notes.
yeah, I mean, I think definitely just communication with your doctor. We were super lucky. Our doctor is an awesome fertility doctor. We're lucky that we can afford it, and the help from you guys is humongous, and letting us do that. But I think just the open, constant dialogue and communication with her is probably like the number one advice, because I feel like you can bottle up questions and thoughts and frustrations, and there's somebody that probably has a better answer to give you, and they're normally just a phone call away or e-visit away. So I think the biggest advice, from my perspective, is just those like regular visits, setting those up, taking the time, finding a good provider that you can trust. Even if for us, it's a bit of a drive to go to the one that we go to, but it's worth it because she's awesome. So
Yeah.
Uh,
I used to, sorry, go ahead, Kat.
oh no, I don't necessarily have about like the medicine stuff, things that I would recommend, but I think the biggest thing that I always have to remind myself, because you always hear like, oh, this is this person's story and this worked for this person, and everyone's journey is just so different and you can't compare yourself. Um, that's like a huge thing. And then also just communication with your spouse, partner, um, and just make sure they know. Like, a big thing for me was like that we had to work through was like what really triggered me, um, when I was in a rough patch. And I don't know if he knew, like, until we really had a good conversation, like, this upsets me when I see that or if I hear that. And now that we have a real understanding of, how to navigate like these feelings and these life events, and that has been really helpful.
Yeah.
yeah, we've talked about in therapy. It's like it's nothing about seeing somebody else, have a successful pregnancy or anything like triggers me. And it's like I wouldn't even put two and two together that for her that could be like a disturbing event until we like sat down and talked about it. So yeah, you can avoid a lot of emotional angst and struggle and like be a more supportive spouse by just having those conversations, probably on both sides.
Yeah. That's so funny. My husband came home. We were in this little apartment, and he came home one day and he was like, hey, so and so is pregnant. And I was like, that's awesome. I just started bawling, and he was like, why are you so sad? And I was like, because we have been trying for so long, and like I didn't even know they were trying, and they're pregnant, and I'm super happy for them, but I'm also like super sad for me. And exactly
Yeah.
like you just said, Chris, he was like, why are you sad? And I
Yeah.
was like, How can you not be sad? Like that's
Exactly.
them and it's not happening for us. Anyway, that reminded me of that. That's so funny.
Yeah, very similar.
Um, well, I think too, ours is male infertility, and I tell everyone and anyone, I'm like, just get everybody tested right away at the beginning. If they're gonna try and put you through like water ultrasounds and ink and this and that and biopsies, test you both. Like just get that one out of the way because it's so easy to just test that and know, you know? And I think for like people that have endometriosis, maybe also like tell your doctor if your periods are painful or if there's anything that you feel like, I'm sure that's normal, like explain it. Maybe it's not and it wasn't for you. You know, I mean it was normal for you, but it was abnormal and gave them an idea that maybe that was your thing, you know?
Yeah.
Yeah, absolutely. I think sometimes, like hindsight's always 2020 always, but
Yeah.
like we tried for a long time naturally, which is exacerbated by the fact that, I might not be here for the next 3 months and then I'll be back for a month or two and then I might be gone for another couple months. But we tried for a really long time. And I do wonder sometimes if we'd went to a doctor a little earlier in the process and had some conversations of like, maybe some of this could have come to light a little quicker. And it may not have, but I think it probably would have been worth, sooner rather than later, like doing some of the testing, like you're talking about. It would have removed a couple questions here and there, and it may have led to, us being a little farther along.
Yeah. And I know it's like kind of awkward information, right? Like sex life stuff, period stuff. It's all like really, you're like, I barely know you. So I'm so sorry, but I'm going to tell you all of the things, you know? But it's like the more information they have, the
Yeah.
better. You know, the better they can be like, oh, that is a little abnormal, or I'm glad you told me that, or something. So I know for people that are listening, this might be like, so you might think like, oh, TMI, TMI, TMI. I remember telling my doctor that all the time. I'm like, okay, sorry, too much information, but, and she's like, no information is too much for me. I need to know everything. I'm like, okay, and then here you go. So I think that's really important. Is just like, say it all. Whatever you think could be like a one tiny little red flag, just say it. And then that might lead them down a path that can figure something out for you, especially people who have like unexplained infertility. I feel like there's always something, PCOS or endometriosis or morphology or something, that is maybe not quite right
Yeah, I mean, we
perfectly.
were in that unexplained camp for quite a while. It was like we could
Yeah,
not figure it out, and the doctor wasn't sure, and that's such a frustrating place to be.
it
Yep.
is.
And we didn't cover this, but I actually found out that I have celiac disease on this journey as well.
Oh gosh.
Um, so 3 months into trying, we just got blood work done because I pushed for it and saw my thyroid was like a smidge high. And so trying to get my thyroid level balanced, I ended up being on a really high dose. And my endocrinologist was like, do you think that you have celiac disease? Maybe you're not like absorbing this. Like maybe you should give up gluten. And I was like, me? No way. I love bread. Like, absolutely not.
Yeah.
And she did this antibody test on me and I was positive for celiac. Um, Now, this is like some advice. So I went to a GI doctor and they were like, of course, they would want you to keep eating gluten and then scope you. And she said my antibodies were not high enough that she didn't think I have celiac, but giving up gluten has been life changing for me.
Really?
And I look back now and I see the side effects and the symptoms like endometriosis that I just thought were normal.
Yeah.
Um, I never understood how someone could drink a beer and eat a meal at the same time because I would just feel so full. And now I know it's because of the gluten would make me feel like super full and bloated. So that has been another like silver lining of this journey is like figuring that out, and my energy levels have improved. I just feel way more balanced, and yeah, I'm so thankful for that.
Well, we are super happy for you guys.
We're so thankful
Yeah.
for what you guys did for us. Like it means the world. It hopefully plays a part in us having a family. So that's huge.
Yeah, I think it's gonna happen for you guys. There's just too many good omens in your
Yeah.
story
I,
at this point.
yeah, I do too.
Our doctor literally said so after the embryo was normal, we had a video call with her to, figure out the planning for the transfer. And she literally said to us that she was just so glad that we could afford to do a third egg retrieval. And it was just such in large part thanks to you guys, that burden that it took off for, we used your grant money for our second retrieval. And so we were able to save and just so much more easily afford this third retrieval that got us our 2 embryos. So
I'm so happy. I'm so glad that it helped. And sometimes it like couples will be like, it didn't happen like on the round your money helped us with, but we wouldn't have done that round. And now we know so much more about what we need to do going forward that it just gave us like the stepping stone we needed to continue.
Yeah.
So I'm
Absolutely.
super glad that that happened for you guys. Keep you guys in our prayers, and we are super excited for that good news that you got. You could deserve it. And thank you for sharing this with the infertility community. Our small little group on here is going to be so grateful to hear that you just kind of keep putting one foot in front of the other. You take the breaks when you need to, and then sometimes everything just falls right into place. So
Yeah. Fingers crossed.
yes, exactly.
yeah, thank you.
Yeah. Thank you so
Okay,
much.
well, thank you guys so much and enjoy your weekend.